Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'd like to talk to y'all about oral phenylephrine. An FDA advisory committee just met a couple of weeks ago and unanimously decided that oral phenylephrine is not effective as an oral nasal decongestant. And I know as we're moving into cough and cold season that a lot of the cough and cold medications that everyone has at their house contains phenylephrine. Now, this advisory committee is not saying that phenylephrine isn't safe. They're just saying that it's not effective. But my point is, if it's not helpful, why take it? This FDA advisory committee looked back at data from many, many years, and there's actually been this controversy stirring since about 2007 when this data came up that it may not be that effective. And ongoing studies have been done that shows, yes, for sure, it's not effective. It didn't work any better than placebo. Even at twice the recommended doses, it did not make any difference. It wasn't any more effective than placebo. So the FDA now needs to decide whether they should remove it from the market completely or if they should just leave it on the market. But I'm telling you guys, as we're moving into cough and cold season, phenylephrine is not effective. The reason they think that is because really only a tiny, tiny amount actually reaches the nasal passages. So the body just isn't getting enough medication to make a difference. Okay, so people are going to ask me, what's a good alternative? Well, I've known for a while that oral pseudoephedrine is much better as an oral decongestant. However, the barrier to that medication is that you have to talk to the pharmacist to get it. It was moved behind the counter, I think in 2006 or 2007, when it was determined that pseudoephedrine can be used to make methamphetamine. So that is a barrier. You have to talk to the pharmacist in order to get it, but it's really effective. And it can be dosed in immediate relief form, usually at 60 milligrams every 4 to 6 hours. It can be used as 120 milligrams every 12 hours, or some of these long-acting medications like Claritin D 24-hour or Allegra D 24-hour can last 24 hours. I don't love when patients take pseudoephedrine, the 24-hour dose, because it does prevent people from sleeping, but as an oral nasal decongestant, it works really well. The things that people need to watch out for are a raise in blood pressure, and it can also make you feel kind of jittery and increase your heart rate. So use it for the smallest amount of time that you need it, and always talk to your doctor. Another option is nasal phenylephrine. Now, that was never under controversy. We know that that works really well. It's a topical formulation. You just spray it in your nose. Think of it like Afrin, although the active ingredient in Afrin is called oxymetazoline. They're very, very similar. So nasal phenylephrine and Afrin work very similarly, and they work very effectively, and you don't have the same systemic effects. Okay, I hope that helps as we're moving into cough and cold season. Thanks for joining me.